Hello, everyone. My name is Julia Daun, and I am a PhD candidate and clinical exercise physiologist working with Dr. Nicole Culos-Reed in the Health and Wellness Lab at the University of Calgary in Alberta, Canada. Today, I am presenting to you on our Alberta Cancer Exercise Neuro-Oncology study that I'll refer to as ACE-Neuro going forward. I'm very excited to be here with you all today and share what we've done with ACE-Neuro so far, where we're going, and the impact of this work. Before I do jump in, I want to acknowledge two things. The first being our incredible study team. They're all listed on the slide here. We've got an incredible group of clinicians, students, exercise professionals that work to bring the magic into ACE-Neuro. They are passionate about this work, and we've done so much together as a group. So we wouldn't be where we are today for ACE-Neuro if it wasn't for them. So big shout out to our study team. And I would also like to acknowledge the land on which this research is taking place. So that is Treaty 7 region in Alberta. Today, we're going to be sharing, or I'll be sharing with you today, ACE-Neuro, the study of exercise for individuals living with and beyond brain cancer. What the research has shown us to date and what we know is that exercise is an evidence-based resource for individuals living with and beyond brain tumors, so our neuro-oncology patient population. Unfortunately, neuro-oncology patients lack access to exercise, to this evidence-based resource that we know can support them in their well-being. So to help fill this gap, ACE-Neuro is being delivered and examined across Alberta in both Calgary and Edmonton. We are recruiting all neuro-oncology patients with a primary brain tumor, whether it's malignant or benign. They can be on or post-treatment. They must be over 18 years of age and able to consent in English to participate in our study. We are hoping to recruit up to 100 participants over the next 2 years, and we're recruiting in both Calgary at the Tom Baker Cancer Center and at the Cross Cancer Institute in Edmonton. ACE-Neuro includes a direct referral via the electronic medical record to us, the study team in ACE-Neuro. So what this means is participants are identified by their clinical team in their neuro-oncology clinic. So the oncologist or the nurse that's working with these patients identifies a participant who may be eligible for ACE-Neuro, and then they send that referral to us through the electronic medical record. We then see participants in a neuro-oncology triage clinic where we complete a full health history, a full neurological exam. We go through participants' preferences for exercise and physical activity. And then we also perform the short physical performance battery protocol test where we look at the participant's function. Based on all this information, we can then triage patients to either occupational therapy, physiotherapy, physiatry, so rehabilitation medicine, or exercise, or a combination of these services. For those who are referred or triaged to exercise, they begin the 12-week exercise program, and I'll tell you more about that in just a moment. In addition to that 12-week program that they would get as part of the study, participants complete assessments of patient-reported outcomes, so things like their quality of life, symptom burden, fatigue, physical activity levels, and their functional fitness, so looking at things like their endurance, their muscular strength, their cardiorespiratory fitness. We look at that pre and post 12 weeks, and then again at 6 and 12 months. At the end of the 12-week program, we also invite all participants to participate in an interview. And in this interview, our goal is to better understand what the experience of ACE-Neuro was from their perspective. So we're interviewing the participants, their caregivers, and even healthcare providers. So the clinical team, oncologists, nurses, the administrators, unit managers working in neuro-oncology, our exercise professional team, to really get an understanding of what ACE-Neuro looks like from these perspectives. In our interview, we're also using a photo illustration approach, wherein photographs that have been captured across the 12-week exercise program are presented to participants to help elicit memories and thoughts and feelings and to guide the interview process. So taking a little bit of a closer look at the exercise program, participants receive both one-on-one and group-based exercise. The idea is that we are tailoring this program completely to the individual needs of each participant in the study. So participants may deem that they prefer to stay one-on-one with an exercise professional the entire 12 weeks, and that's okay. Other participants move on to have one-on-one exercise session per week and one group session per week. And this kind of timeline of when participants move to group is very much dependent on their preferences, the clinical perspective of the exercise professional, and just what works timing-wise for the participants. All of our exercise sessions take place either via Zoom or in person. So this study did start during the COVID-19 pandemic, and so everything was taking place virtually. But now that things have opened up, we give all participants the choice to participate either on Zoom, in person, or even a combination of the two. Again, really just trying to cater to their needs. In addition to the actual exercise, participants are provided with health coaching. So these are 5 to 15, even 30-minute calls that take place typically after one of the one-on-one or group-based sessions. And we cover a number of education topics to further support participants in their wellness. So some of these topics have included barrier management, setting goals or intentions, self-compassion, sleep and fatigue, and really introducing these in a way to support participants throughout their time in the study. Participants are also provided with a Garmin activity tracker. So this is a watch that they wear across the 12 weeks, and it tracks all the hard work they're putting in with their physical activity and their steps, and they're able to track that through their Garmin activity tracker app. Across this entire program, I know I've said tailored a couple times, but we absolutely individualize it to meet participant needs. So we generally follow the cancer and exercise guidelines, and we make sure to include a multimodal program where participants receive aerobic, resistance, and flexibility training. But depending on that triage assessment that I told you about a couple slides ago, depending on their neurological exam, the placement of their tumor, the type of treatment they're undergoing, their preferences for exercise, their exercise history, we take all of that and then tailor the program specifically to each person. And then within this, we're also being as flexible as possible because we know that this is a population that undergoes intensive treatments, symptom burden is high. We need to be flexible and move sessions around depending on participants, how they're feeling that day, what appointments they have. And so we're really trying to take this this model of the exercise program that Dr. Nicole Culos-Reed has been delivering for years and years through the Health and Wellness Lab and through our general ACE Alberta Cancer Exercise Framework study, and then tailoring it, being as flexible as possible to meet the needs of this neuro-oncology patient population. Here is a couple, a few photos that can visualize for you a little bit what these sessions have looked like to date. There's a couple of examples of what the sessions look like in a one-on-one capacity and what the group class looks like. We are continuing to deliver this both online and in person. So more photos are being gathered for in-person programming as well. But this is just to show you what this can look like, the smiles that come in the class, and that participants are having a fun time, even in the Zoom platform, which has been amazing, and really accessible for participants during the pandemic. So to date, we have recruited 59 participants into our ACE-Neuro program, into the study. This recruitment opened in April of 2021, so we've been going for about a year and a half now, and we're expecting to close recruitment this December, so winter 2022. Across the 59 participants that have enrolled into ACE-Neuro, we have completed 16 interviews. These interviews are ongoing, and we are also completing interviews with caregivers and the clinical team, like I mentioned before. So this work is going to continue on. Our last participants will come through the study the beginning of 2023, and then we're going to start analyzing our data and hope to have some results out in 2023. As an example to show the impact of this program from the participant perspective and what some of the data has come in as from our qualitative interviews, I'd like to share this one quote with you from one of our participants who shares that participating in the ACE-Neuro study has been a positive experience in their life and that they feel that they're in a better position today because of ACE-Neuro. So this is just an example of what we've been seeing so far with our data, and there will be more of this to come. We have a lot of really rich and amazing qualitative data that's coming in through the interviews, and we'll be sure to share that once our results are fully analyzed and ready to go in 2023. If there are a couple thoughts that I leave you with today to think about what ACENeuro is and the impact and the work that we're doing, is that one, ACENeuro includes a direct referral within the clinical care pathway for neuro-oncology patients. So what this means is that we are streamlining access to evidence-based resources like rehabilitation and exercise so that we can provide access and a streamlined access to participants so that they can include rehab and exercise as part of their standard cancer care. Within ACENeuro, we are utilizing a patient-oriented research approach. So really trying to tailor to the needs of each participant, tailoring the exercise program, the format of delivery, the type of exercises that we're doing to really meet the needs of each person that comes into our program. They may all have a primary brain tumor, but we know that no treatment or no experience in cancer will be the exact same. So really trying to hear what the participants need and meet them where they're at. And then finally, we're utilizing and gathering the patient voice to understand what the impact of exercise and of ACENeuro is on their well-being, on their cancer continuum, the treatment trajectory they've been part of. What does ACENeuro look like to them? What does it mean to them? And what is the feedback they might have so that we can improve this going forward? But really, again, focusing on the experience from their eyes, from their perspective. This work would not be possible without our funders, so the Alberta Cancer Foundation, who has generously funded this work over the last year and a half, and also my personal funders, so the Canadian Institutes of Health Research, the Traction Program, Eyes High, and Alberta Innovates, who have very generously funded me across my graduate studies to date. So a big thank you to all of these funding organizations who have supported ACENeuro and my personal work in ACENeuro. If you would like to learn more, you can scan the QR code on this slide. We have the protocol paper, which outlines all of the details and all of the components of the ACENeuro study. It's linked on the slide here. You can also visit us at www.thriveforcancersurvivors.com, or you can always send me an email. I posted it on the slide as well. It's jtdaun@ucalgary.ca. And you can also follow us on Instagram or Twitter at WellnessLabU of C. I'd be happy to answer questions at any time, so please feel free to reach out if you have them. Here are my slides for the presentation today. And again, a big thank you for allowing me to share a piece of our work, our ACENeuro study with you today. And I'm looking forward to sharing the results with you once we have them in 2023 and into 2024. Thank you so much.